When it comes to money, we have people all around the world telling us exactly what we should be doing with our money. We should invest in this. We should put it in that. 60-40, stocks and bonds. This is the way to financial freedom. But maybe they don't know what they're talking about. And if the financial experts don't know what they're talking about, is it possible the medical experts don't know what they're talking about either? Today, I'll be going through a thread posted by the Bitcoin therapist that talks about the health side of things. The health of our nation is broken. Here's what you need to know about the dollar-based healthcare system and why Bitcoin is the answer to our health. The Fiat Disease, author at Amos MD. My life dream of becoming a physician is so different than the reality I'm working in currently. Instead of healing people, I work in a system that aspires to only manage disease, hiding symptoms with toxic medications as patients continue their downward health spiral. That already sounds like the fiat disease to me. You go to work, you make your fiat dollars, and you go to an expert, your financial advisor. They tell you what to do. You put it in something that you hope will have a return, and sometimes they're right, sometimes they're wrong. They're just hoping for the best. Despite the US spending nearly twice as much on healthcare as other high-income countries, it still ranks among the lowest on various health measures. Right here on this chart, we show health spending per capita at $12,318 for the US, which is the highest by far of anybody else on this list. And then it shows the life expectancy lower than anybody else. We've got it right now in the United States at 76.1 years, and that's lower than the United Kingdom, Germany, Austria, Netherlands, Belgium, France, Sweden, Australia, Switzerland, Japan. All of them are 80 or higher. This is often blamed on greedy corporations, but having spent more than a decade in the healthcare system, I've come to conclude that the problem is not in the people's love for money, but in the money itself. I find it so interesting that a diseased money can cause problems everywhere else. You might just think, money is money. No. Money is the base layer of kind of everything. Once you understand what money is, once you see that it is the transactional blood of the entire world, and once that's diseased, then of course everything else will become diseased. Restrictions on the number of providers and mandated health insurance have led to unbalanced market, a system that is maintained and propagated by our current fiat dollar-backed money system. In World War II, the government enforced wage limits, forcing employers to use health insurance to attract laborers. These benefits became tax-exempt in 1942, leading to a large expansion in insurance coverage. This was increased with the enactment of Medicare and Medicaid in 1965. Moral hazard: the tendency of insured people to utilize healthcare resources more than if they were uninsured. Patients will pick the more expensive, if only slightly more sensitive, test or try to see their physician more often. Why? Because it's free. The astronomical increase in demand due to mandated insurance coverage, combined with a restriction in the supply of providers, has played a large role in our current healthcare crisis. The most devastating effect of the AMA policies, in my opinion, is its suppression of alternative, non-pharmaceutical methods of healing. In a free market model, the effectiveness of these methods should be judged by the consumer, not by a central authority. Let me paint you a little picture here. If Bob goes to a healer, some non-traditional healer, and it doesn't work out well for Bob, but maybe Sam and Billy and Roger and Tamitha and Susan, they all go to the healer and they say, well, I had a bad foot and the healer fixed my foot. So maybe the healer's methods just didn't work out for Bob. Does that mean that the healer should no longer be in business? No, it should be up to the consumer to decide if that person works well for them. That's like saying that one therapist should be the therapist for everybody. Well, you're going to interact differently with different people. You're going to be able to converse better with this person and maybe not so well with that person. But just because you can't have a good conversation with this person doesn't mean that they shouldn't be in the therapy business. Maybe they just speak better to other people. Maybe they're better with children. Maybe they're better with older people. They should find the fit that's good for them, just like you should find the fit that's good for you. This is true of the medical world. It's true of the financial world. It's true of housing situations. It's true of jobs. It's true of basically everything. It should be left to the free market for individuals to decide what works for them. This should not be a centralized thing. This is true of money. It's true of housing. It's true of education. And it is certainly, if not most true, when it comes to money. That should be decided by the people at large, not a centralized authority. If they, the non-traditional methods of doing things, are pseudoscience, as Flexner claimed, and less effective than pills, then the market will confirm that, as people would not visit these providers and they go out of business. The Flexner Report was not for the advancement of medical education, but the creation of a big pharma monopoly on medical education. Flexner's ties with pharma are well documented. In his book, The Progressive Era, Murray Rothbard described the early 1900s when the state changed from an entity concerned with the protection of people's rights to one aiming to ensure its citizens' economic well-being. An unholy alliance between state intellectuals, big businesses, and politicians was established to cartelize various fields of industry. Large business owners wanted to remain in power, and they did so by employing experts, such as Flexner, to recommend government mandates. Under a Bitcoin standard, governments no longer have access to free money to finance their authoritarian, centrally planned projects. Impositions that are not economically productive are unlikely to survive for long, as people, Bitcoin owners, are unlikely to fund them. Medicine under a Bitcoin standard. Licensing and training regulations would no longer be state-mandated, but governed by market forces and patient preference, promising the reemergence of more traditional methods of healing and unprecedented innovation in patient-directed care. Again and again, we see people in positions of power thinking they know what's best. The hubris to come into the metaphorical room and say,
"This is the way things should be done. I know what's best for these people. I have the answer to fix what ails them."
Who do you think you are? I certainly don't have those answers, nor do you, and I could be pointing to anybody on the entire planet. You don't have the answers to fix all of what ails people. No matter if that's a financial ailment, no matter if that's a medical ailment, it doesn't matter. Nobody has all of the answers. And if no person has all of the answers, then no person should be trying to give all of the prescriptions. It just doesn't make sense. A Bitcoin standard encourages individuals to figure out what works best for them. That means, what is my best diet? What is my best health regimen? What is my best financial situation? What is my best housing situation for me? Not, how can I tell that person what to do? No. This is what is good for me and the people that are around me. And that is where you focus. And if you're doing that for you, and this person's doing that for them, and this person's doing that for them over there, then of course there is going to be mutual cooperation. If you've ever played a team-based video game, you know exactly what I'm talking about. There are situations where you need to do exactly what's best for you. If you're a healer in an MMO, you might need to move out of the fire pit that's erupting under your feet so that you can then heal your teammates. But that isn't because somebody else is telling you what to do. You're just doing it because it's what's in your best interest, which is then better for everybody else on your team to defeat the dragon boss. That's how that works. If we're going to defeat the dragon of tyranny, we need to think like Bilbo. We need to be sly and clever and work in a roundabout way. Our ring is Bitcoin, and with it, we will sneak the ultimate treasure of freedom back from the clutches of big government. And once that happens, all people, not just a select few, will be healthier and wealthier.